is WVVA in Focus, a weekly program about important issues and events in the two Virginias.
Good morning and welcome to this edition of In Focus. I'm Melinda Zosh.
And I am Martin Staunton. October is Breast Cancer Awareness Month, and this morning we're discussing the importance of mammographies.
Joining us this morning to shed some light on this is Dr. Fred Barker, and also we have Kelly Blankenship, a breast cancer patient, and nurse practitioner Keisha Saunders, all joining us in the studio. We also have another guest joining us via Zoom, Melva Bowles, a registered radiology technician.
Dr. Barker, we'll start with you. So, who should receive a mammogram?
Well, Martin, I think let's make things very simple. Women 40 years old and older should have a screening mammogram every year. But I think it's really important to distinguish between a screening mammogram, which is a mammogram when a woman is having no particular problem, it's part of her health maintenance routine, versus having a diagnostic mammogram, and that's when she has a complaint or when something has been found on screening mammogram that needs to be worked up.
And Keisha, I'll ask you this and then Melva can jump in right after, but explain to our viewers exactly what is a mammogram?
Well, a mammogram is an image of the breast to look for any kind of abnormalities.
And Melva, can you elaborate more for our viewers on what exactly a mammogram is and the process of getting a mammogram?
Well, we use the machine and we have to actually compress the breast, and we get 4 different images, 2 of each breast, and that way the doctor can see if there is something in there, they can tell exactly where it's at. But it's mostly just x-ray.
So, with an X-ray mammography, which is better, analog film or the digitally displayed images?
Well, I think that
Digital is much better.
Chime in here a little bit. I think that what we can say today, analog imaging is useful only for historical purposes. In other words, we may get old films from someplace, but generally digital mammogram is really the standard of care today, and actually this has even been upgraded to have what's called breast tomosynthesis, digital breast tomosynthesis, also known as 3D mammography, and most facilities now are able to do 3D mammograms, which give even a little bit improved view of the breast from just a 2D digital mammogram.
And Martin has a really important follow-up question for you, Dr. Barker.
So, for whatever reason, I thought that all mammograms were ultrasound.
Yeah.
I was surprised to hear you talk about them being X-rays. What's the difference between an ultrasound mammogram and the X-ray mammogram, whether it's digital or analog?
Good question.
Well, mammogram just means it's breast imaging. And basically there are 3 main forms that breast imaging is done in today. There's X-ray mammography, and that includes digital mammography and the newer 3D mammography. There's ultrasound exam, and that's completely different. It's a different energy source. And then there's also MRI of the breast, which is another way that the breast is imaged. But as far as screening mammography, and that's really what we're talking about today, is women should be going every year for screening mammograms. That's most cost effectively done through 3D mammography, but some women have breast density that makes a 2D mammogram perfectly acceptable.
And Keisha, why is screening so important? And share with our viewers kind of your role as a nurse practitioner and how you're helping these patients.
Well, my role as a nurse practitioner is to encourage our patients to get mammograms because early detection is important and vital for survival.
And Melva, can you also elaborate more on why these screenings are so crucial and how they really can save the life of a woman?
When you detect a breast cancer early, then the treatments are there to actually get rid of the mass or the tumor. They may not have to go through as much if you catch it early.
My question is for Dr. Barker. Earlier you said that you recommend that women 40 and over have that screening annually. Is there any reason for women younger than 40 to start seeking annual mammograms?
Well, the only reason would be if they are, what we generally say is women of average breast cancer risk should start having mammograms at 40 and have them every year. There are some women who are at particularly high risk, but that's a very small minority of women, and they may have recommendations for having screening mammograms started earlier. Also, I think it's important to point out that what we've been talking about is screening mammograms. Now, mammograms may be recommended earlier than 40 if a woman is experiencing some kind of breast problem. Then it would be appropriate to do a diagnostic mammogram. It's the same kind of study, but it's done for a different purpose.
I guess what I wanted to ask is, like, say a woman's mother had breast cancer and grandmother had breast cancer, even though she's not feeling any symptoms, there's no lumps, is that person encouraged to come in earlier than 40?
Probably not.
Okay.
I think what's important to point out and for people to understand is that in 75% of women who develop breast cancer, there's no family history of breast cancer. The things that I would say might prompt a woman to get a mammogram early, get a screening mammogram earlier than 40 years old is, let's say if she had a mother who developed bilateral breast cancer at 40 and a sister who developed breast cancer at 38, and she was coming in for some advice on what to do and was 35, I might well say it would be a good idea for her to start a screening program at that time.
Oh, good answer. Thank you, Doctor.
Yeah, absolutely. And Melva, this next question is for you. What if a woman is going to one facility and getting her mammogram, and then she goes somewhere else? Is that recommended? Should she stay at the same facility? And how does a facility go about getting these records for each woman?
As long as they're getting their mammogram and it's at least on a digital machine, then going to a different facility is fine. And all the facility does is we send a release for information to get those images from the other facility.
Thank you for that. And Keisha, what are some of the warning signs of breast cancer? I know as a woman we hear a lot about lumps. Is that still the case? Are there other warning signs?
Yeah, there are lumps and pain, some nipple dimpling, inverted nipples, all can be signs of breast cancer.
And if a woman does find those signs, what's the first thing she should do?
She should call her primary care provider.
All right, we have much more to talk about, including we're going to talk more to Kelly about her story as well. We'll be right back after this quick break. Good morning, everyone. Welcome back to this edition of In Focus. I'm joined with co-anchor Martin Staunton. I'm Melinda Zosh. We're talking about a very important topic, Breast Cancer Awareness Month, and the importance of getting a mammogram.
Yes, we have a distinguished panel of guests, a nurse practitioner, a doctor, someone who works in radiology, but we also have someone who's lived with this diagnosis, Kelly Blankenship. He's out of Welch. And Kelly, let me ask you about your story. What sent you to get the mammogram in the first place, and what was it like hearing those words that you have breast cancer?
Yes, well, I have had some issues with lumps for the past 5 years, and I knew as long as there was pain there and you could feel a lump, I knew that I needed to get checked. So it was around April of this year, there was a lump and it didn't go away for a few weeks. So therefore, I knew I needed to get checked. I also had pain as well. It was one of those things I hoped that would go away, but it didn't. So therefore, I made an appointment and I seen Dr. Barker, just like I had for several years in the past. I was hoping I was just going in for a routine exam, have a mammogram, get checked, and they would just say, you know, that it's going to go away. It's nothing to be concerned about. But this time was different. I found out in June, and hearing the news that this time it was actually cancer, it was a lot to take in. You know, you can prepare yourself for that, but actually hearing the words, you can never prepare yourself for that. It was something hard to take in because it not only affects you, it also affects your family in so many ways. But it's just best to get checked as soon as you find a lump or have pain. It's so important to get checked right then.
Dr. Barker, let me ask a quick follow-up question with you. When you discover a lump like the one that Kelly has, how soon does treatment to fight the cancer start?
Well, I think that there's some really important aspects to Kelly's situation that are worth mentioning. Kelly came a couple of years earlier with some concerns, basically the same kinds of concerns that she had this time. And at that time, we did a mammogram, an ultrasound, and even did an MRI because she has particularly dense breast tissue on mammogram. And all of those studies were completely normal. But this time, while the time that she came to see me, she was saying the lump was really resolving and getting smaller. We did a mammogram and there was a dramatic change on mammogram, and we followed that up with both ultrasound and MRI, which was consistent with a fairly aggressive kind of breast cancer, and she's done very well at this point.
So then, Kelly, walk our viewers through what your treatment has been consisted of, what it's consisted of since June, and what the process has been like. Can you shed some light on that for our viewers?
Yes. Well, since June, once Dr. Barker found that it was cancer, I've had MRIs, sonograms, blood work, and I was able to have surgery in July, about 30 days after I was diagnosed with the cancer, and Dr. Barker was able to remove all of the cancer, so that now I'm cancer-free, and that has so much to do with the early detection. If I had waited much longer because of the type of cancer that it was, the aggressive cancer, I probably would have had a different outcome. So I was able to have surgery and able to have that cancer removed.
Keisha, let me ask you a question, because for Kelly, all of this unfolded under the umbrella of the pandemic, and I've seen stories where people have put off routine screenings of all kinds, including mammograms, because of fear of COVID. Make your pitch to those people who are sitting at home watching this right now thinking, I ain't going to the doctor's office while that COVID's out there.
Yes, you do not need to wait. A lot of facilities have implemented protocols. They're scheduling patients a good distance apart so that the waiting rooms aren't crowded. They're separating seatings in the waiting room. So do not put it off. You need to go have it done.
And Dr. Barker, do you have concerns with the pandemic that people are putting off these screenings, and what are the repercussions of that you've been seeing so far?
Well, absolutely. I think that we're going to see following, the next several years following the beginning of the pandemic, we're going to see certainly cancers of all varieties picked up a little bit later than they might have been if routine screenings for colon cancer and breast cancer had been done as we would expect they should be, as well as other diseases that aren't being monitored quite as well. So I think that it's very important at this point. Certainly having people get vaccinated is very important. That dramatically cuts down your risk of developing COVID-19. I think that all of the facilities at this point have protocols in place. We all wear masks in the facility. We encourage patients to be vaccinated. We keep space where we can. So I think that it's important that we get back into recognizing that COVID-19 is not the only health problem that's around.
Kelly, can you talk about, for you, where you are in your fight? You're cancer-free, and God bless you for that. But for the same reason as I asked Keisha, for those women out there who are thinking, you know, they'd rather take the risk of an undetected cancer versus the possibility of catching COVID. You went in during the pandemic to make sure that you were okay, and it turned out that you weren't. What do you say to those women who were sitting where you were sitting, but unlike you, they're doing nothing?
Yes, it's so very important. You know, no matter if, you know, COVID-19 is going on now, you know, women know their body. You know if something isn't right. You know if you're having pain there and you didn't have pain before. You know, when you do your self-exams, you know, we all know, you know, when something isn't right. And as soon as, you know, you detect pain or detect a lump, it's so very important right then to call and get an appointment, because it's so true that early detection makes such a big difference, you know, especially with the different types of cancer, with the aggressive cancer. Just as with myself, if I had waited, you know, a couple weeks or a couple of months, my outcome would not be as great as it is now that I am cancer-free. So early detection is so very important. No matter what's going on, you have to get checked.
And Dr. Barker, can you elaborate upon the different stages of breast cancer and why early detection is key, and the process of treating early detection breast cancer versus a woman who's experiencing late-stage breast cancer?
Sure. Well, I think that one of the things that's really important is to use Kelly's situation as a perfect example, because Kelly came in initially, you know, a couple of years ago to have a questionable breast problem evaluated, which she had, and all the imaging was completely normal. And this time, although she initially was having really the same kind of complaints that she was having before, and in fact, when she came to see me, she said, well, this is really getting a lot better. I was really thinking of not even coming for this. It was really her time to have a screening mammogram anyway. And so that's what's really important to understand. What we ought to be promoting now is screening mammograms. That doesn't mean that the woman has to have any complaint at all. It's just if you're 40 or older, get a mammogram every year. And the thing that was so impressive in Kelly's situation is that in the little bit more than a year and a half since her previous mammogram, she had a dramatic change on mammogram. Now, the kind of change she had, while it was a dramatic change, it was really the change of a kind of breast cancer which tends not to spread very far. Tends not to spread to lymph nodes, tends not to spread elsewhere in the body, and that's called ductal carcinoma in situ. But in Kelly's situation, because the relative size of the area that would need to be removed compared with the size of her breast, she really needed to have a mastectomy. And she was lucky because she had a skin and nipple sparing mastectomy, which means reconstruction down the line is going to be a much, much better option for Kelly. Also, we noted when we looked at the specimen that she also had a small focus of invasive cancer, and that is the kind of cancer that can spread elsewhere. But because of how this thing presented, we did a lymph node sampling, and those nodes were negative. So she really was in a very good situation on this. So when we talk about having an aggressive tumor, what I think that we need to know in Kelly's situation is it made a very dramatic change in her mammogram over a very short period of time. And that's why I think it's so important for women to get their mammograms every year, even when they're not experiencing any kind of problems at all. That's what screening mammograms are for.
It sounds like the subtitle here should read, catching it early could save your life.
Absolutely. Early detection saves lives.
Need to take a quick break. More to talk about. We'll be right back after this. Welcome back to this edition of In Focus, everyone. We're talking about the importance of getting your mammogram and screenings and how that really could be the difference between life and death. Now I would like to share some information about where women can go get their screenings. I'd like to bring back in Melva Bowles for this question. So Melva, share with our viewers where they should go to get their screenings.
Well, we do mammograms at Dr. Barker's office. You can go to community radiology, which is close by. Princeton Community Hospital does mammograms. Most of the hospitals in the area do mammos. If you don't have insurance, Bonnie's Bus does go around and you can usually get your mammogram free. Right now, some facilities are actually doing some promos for mammograms this month since it is Breast Cancer Awareness Month. So it kind of makes it cheaper for if you don't have insurance. And also, West Virginia actually has a program of West Virginia BCCSP for people who qualify for that they will pay for some screening mammograms also.
I was going to ask, are there other resources? I know in some situations, there's organizations out there that provide grants and that type of thing to help with these type of expenses. Are there any of those, to your knowledge, that people could tap into?
I know West Virginia BCCSP, Keisha probably could tell you more about those type of programs than I could.
All right, thank you. Keisha, well, the ball has been passed into your court. Talk to us about what you tell women when they come in to see you. And, at the end of the day, paying for this is a challenge for them. What do you say to them? Where do you send them?
Right. Women who don't have insurance, it is tough. Medical costs are very expensive, but West Virginia is fortunate in that they do have programs that that are low cost, or if you don't have any, that are free or low cost. And BCCSP is one of those programs that Melva mentioned.
How often does the Bonnie's Bus make this southern West Virginia route? I know I saw it on the news several months ago. When's it coming back?
Yeah, we read it on the news, I remember.
Well, I guess you could go online because you can Google everything these days, right? You can Google that.
Yeah, that's a good point. And of course, we'll keep our viewers updated. So if Bonnie's Bus does come in our area, we'll be sure to let you at home know about that. And Dr. Barker, what happens if abnormalities are identified in these screenings?
Well, let me just address one of your questions here before that you were just going through. I think it is particularly important. All of the facilities do good quality work. You can't do mammography and not go through all of the regulatory steps that have to be done. So I think we all do high quality work. I think that it is incumbent on women to call and because different insurance programs reimburse differently, different facilities participate with the different providers, it really is incumbent on women to shop and call one facility and another, explain what you have, and get a price quote. I think that makes good sense. Now, going on to if an abnormality is found, then additional imaging may be required. Generally, you're going to go see a surgeon if an abnormality is found. Most of us do in-office ultrasound to work up. We do in-office needle biopsies sometimes. There are other kinds of ways that we can do needle biopsies, sometimes called stereotactic biopsy. So these are the initial steps that are done when abnormalities are noted on mammogram, and occasionally we order up MRI as well.
All right, Dr. Barker, we have just a few minutes left, but as journalists, we ask important questions: who, what, when, where, how, why. Let's summarize this whole segment by reminding viewers about those important questions. Who should get it? Why should they get a mammogram? Where should they go? Let's elaborate more on that just to summarize everything.
So who? 40 and older every year. And why? Early detection saves lives. And what? Generally screening mammogram, 3D mammogram is generally best. And where? All of the facilities that do mammography do good mammography. I'd call around to do a price check on all of them.
And Kelly, what advice would you offer to women out there who are maybe on the fence about going ahead and getting that screening? Maybe they say, you know what, it's okay, it's just a little bit of breast pain. What would you say to those women who are on the fence of whether they should go or not?
Oh, definitely. As soon as you know that there's pain, you know something isn't right, call right then, make the appointment. Early detection makes such a difference. Do not wait. Just as soon as you know something isn't right, make the appointment, go get checked. Even if you get the great news that everything is fine, you always have to think, what if it's not? Early detection is definitely the key. So if you're on the fence about it, call, get an appointment. It's the best thing you can do.
And Keisha, just real quickly, 30 seconds. Some people aren't comfortable. They might, feel around and they're not sure. Why should they come see someone like you if they need a second opinion when checking for a lump?
Well, we can do clinical breast exams and just to overcheck what they check, but women know their bodies. So if they feel a lump that wasn't there before, they know it, and they can come to us and we can make a referral.
All right, we want to thank all of our guests for joining us this morning and shedding some light just on the importance of getting these screenings, and it really could save your life.
It really could. And again, a big thanks to the panel. You guys were all terrific. Melba, Keisha, Dr. Barker, and Kelly, we really appreciate you sharing your stories with our viewers.
Yes, absolutely. Thank you all. That does it for this edition of In Focus. Be sure to join us again next Sunday. Have a great day.